Salam Sejahtera. My name is Nicole Chanjiyan. Matric number is 298365. Today we are going to present our report, which the title is The Economic Burden of Smoking and Tobacco-Related Non-Communicable Diseases (NCDs) in Malaysia. Now I will present the introduction for this topic. Smoking and tobacco use, which continue to be one of the most serious public health concerns in Malaysia and one of the most significant contributors to the NCDs burden. They directly contribute to the rising number of NCDs like cancer, diabetes, cardiovascular disease, and chronic respiratory disease. Despite many awareness campaigns and regulation, smoking levels, especially among adult men and young people, are still high, which the data provided is 19%. The Malaysian government is committed to implementing tobacco control measures through the enforcement of the Control of Smoking Products for Public Health Act 2024, where the aim is to reduce the smoking prevalence in Malaysia. Next, in this presentation, my group member will talk about the health effect, economic consequence, and the policy action needed to address tobacco use in Malaysia.
Assalamualaikum and salam sejahtera. My name is Nurdala binti Muhammad Saimi and my matric number is 298345. My focus today is section 2.0, which is the causes and drivers of the economic burden of smoking and tobacco related non-communicable disease in Malaysia. We will analyze this burden through the lens of economic theory and current Malaysian data. We begin with the core theoretical causes on slide 1. First, the failure to control modifiable risk factor. Smoking is clearly the single most significant modifiable risk factor driving major NCDs. The consequences of this failure is severe. High NCD prevalence, which stands at 76% of Malaysian deaths, directly prompts higher utilization of health service. Second, we examine microeconomic failures, specifically bounded rationality and addiction. Due to bounded rationality, consumers discount high future health costs, such as cancer treatment in favor of immediate nicotine gratification. This is amplified by addiction. Nicotine dependence renders demand highly inelastic to price, ensuring continuous consumption despite tax increase. Third, we see systemic market failure through negative externalities. Health costs, including treating second-hand smoke exposure, are eventually imposed on non-smokers and taxpayers. The result is critical, which is the social cost is greater than private costs, creating a core financial gap absorbed by the public healthcare budget. Moving to slide 2, we discuss the contemporary drivers in the Malaysian context. Our main driver is the acute physical deficit and tax ineffectiveness. We observe a negative net transfer. Government spending on treatment, which was RM6.2 billion, significantly exceeds revenue collected from excise tax, which was only RM3 billion in 2020. This deficit is a critical economic burden projected to increase substantially by 2030 to RM8.8 billion. This situation is exacerbated by the illicit tobacco trade. The illegal market provides low-cost substitutes that effectively undermine high excise tax policy. This trade ensures affordability, particularly for the B14 population and youth, maintaining a high risk factor prevalence. Finally, we face emerging threats, namely new nicotine products and urbanization. The NTP proliferations, particularly vaping among youth, risks creating a new generation of NCD patients. This is linked to the urban lifestyle, which is associated with less healthy lifestyle and rapid urbanizations, compounding NCD risk factors. Addressing these threats necessitates a significant regulatory burden, requiring costly new legislation like Act 852, which aims to the total economic burden. This concludes our analysis on the causes and drivers of this escalating economic burden. Thank you.
So next I will explain about the consequences of smoking and tobacco-related non-communicable disease, also known as NCD in Malaysia. These effects go far beyond individual health. They create financial pressure on households, strain the healthcare system, reduce national productivity, and also impact future generations. So first, household financial impact. Smoking-related NCD create long-term financial pressure on family, especially the B40 group. Even with public healthcare, patients still pay for transport, medication, and informal caregiving. For example, advanced lung cancer treatment in private hospital can easily reach tens of thousands of ringgit per year. A nationally representative study showed that 47.32% of B40 households have at least one NCD. Because of these expenses, many families face catastrophic health spending and fall into poverty. Smoking-related NCD also reduce households' income. When the main earners suffer from stroke or heart disease, they may take long leave or stop working entirely. Malaysia loses 51.8 billion every year in productivity due to absenteeism, presenteeism, and premature death. This also increased reliance on social welfare programs. Next, healthcare system pressure. At the health system level, smoking-related diseases are extremely costly. According to WHO, 9.65 billion is spent each year on direct treatment for major NCD. This does not include long-term disability or productivity loss. Chronic diseases such as COPD, heart failure, and smoking-related cancer require long-life follow-up. This leads to high bed occupancy, longer waiting time, and rising outpatient demand. As a result, more resources are used for treating preventable diseases rather than prevention or system improvement. Next is macroeconomic and fiscal impact. From a macroeconomic perspective, tobacco-related NCD weaken labor participation and national productivity. Premature death often occur between age 45 and 64, the most economically productive year. Fiscal impact are also significant. Malaysia collects around 3 billion in tobacco excise revenue but spend over 9.65 billion on NCD treatment. This means that tobacco creates a net fiscal deficit. Illicit cigarettes further reduce government revenue and worsen sustainability. Next is social and intergeneration impact. Smoking also creates long-term social impact. When a household member becomes chronically ill, other family members, usually women and older children, take on caregiving role. This can cause school dropout and also reduce future income opportunity. Second-hand smoke affects children as well. The National Health and Mobility Survey report that 27% of Malaysia children are exposed to smoke at home. This puts them at higher risk of respiratory illness and lower cognitive performance, affecting future productivity. This effect reinforces a cycle of disadvantages that extend across generations. So in conclusion,
raising tobacco taxes is a powerful way to cut smoking rates, especially for young people and lower income groups. But in Malaysia, the benefit is reduced because many smokers turn to cheap illegal cigarettes. Tobacco policy should rely on evidence and focus on both people's smoking behavior and existing regulatory weaknesses. Experiencing from other countries shows that consistent tax increases and proper enforcement can successfully lower smoking rates. Vapes and e-cigarettes also need a stronger regulation. All nicotine products, especially flavored and online sold items, should be strictly controlled, along with campaigns to prevent young people from being addicted. Schools and universities should run strong anti-smoking programs, while quit smoking clinics and nicotine replacement therapy should be expanded and made more affordable. Digital campaigns can also help to reduce vaping. Malaysia needs better healthcare financing for non-communicable diseases. Strengthening schemes like MySalam and Peka B40 can lower the financial burden on families dealing with smoking-related illnesses. A whole-of-government approach is important. Creating a central tobacco control council can help coordinate all ministries and ensure consistent enforcement and aligned policies. Thank you.
In conclusion, tobacco and smoking use is not just a health problem, but it is also a serious economic and social issue. Smoking and tobacco use impose significant health and economic burdens on Malaysia, contributing to rising healthcare expenses and productivity losses. To reduce the smoking and tobacco problem, strengthen enforcement of tobacco laws, higher tobacco tax, and better regulation of vaping products must be implemented. Also, reducing smoking prevalence is important to decrease the NCDs, which can protect the healthcare system and improve the country's long-term well-being. That's all for us. Thank you.